everyone and welcome to our EMS headquarters here in Lyon, Switzerland. I'm Celso da Costa and I'm the head of the Swiss Dental Academy, and I'm here today to talk a little bit about guided biofilm therapy and prevention and prophylaxis. Guided biofilm therapy, GBT for short, is an 8-step protocol that works in a systematic, predictable and minimally invasive way. This will improve the experience of your patients, but also the experience of the clinicians. We are done with the old methods that have more than 45 to 50 years, and today we need to move on for the future. And the future will be prophylaxis and will be guided biofilm therapy. Start with the step number 1, assessment and infection control. In this step, we will know more about the patient, we will ask about their health and dental history, we will ask why they are in our office and what they expect from us, and of course adapt the treatment with their answers. We do the infection control because we need them to run and protect themselves and ourselves about bacteria or virus. And we do the screening with periodontal probing to adapt also the treatment and know about their actual dental health. The second step will be the disclosure. In this step we will use a dye that will show the areas that we have biofilm. We use a two-toner disclosure. This means that we can see biofilm that is mature and the biofilm that is there just for a couple of hours. This will provide the really big benefits for the clinicians, and now we know where to work, but also to use it as a motivation. So now we go to step number 3. This step, because we have the dye and we can see the biofilm, we can explain to the patient the areas where they have more difficult to remove the bacteria, and also we can show how to adapt the techniques and our advice to remove the biofilm to the fullness in an optimal way. Now we can move on for the real treatment of the clinician, where we use the Airflow Max with the Airflow Plus powder. The Airflow Plus powder is a powder based on erythritol, so it's something natural, completely safe for diabetic patients. What we are talking about alcoholic sugar that is not metabolized by bacteria. So we use it with the Airflow Max to remove stains, biofilm and early calculus. Completely safe, minimally invasive, and we can use it on soft tissues, we can use it on healthy teeth, we can use it on composites, implants, crowns, orthodontic appliance, you name it, you can use it, and we have the clinical evidence that prove it. After removing the stains, biofilm and early calculus with the Airflow Max, if the patient has some deep pockets, this means from 4 to 9 millimeters, we can use the PeriFlow. The PeriFlow is the same system as the Airflow. We have the erythritol powder plus air and water, but with a special nozzle to penetrate on the pockets. And if we still have some hard calculus, we can use the Piezo PS instrument. This instrument will allow us to remove the hard calculus in a completely comfortable way for the patient. We have this no pain technology. So we have this dynamic power regulation in our technology that will allow us to have the no pain and a safe environment for the patient. A phobic patient will appreciate and they will come back. Then we go to the step number 7, this is quality control. We will check we will still have biofilm or hard calculus, and we will revisit these areas. If not, everything is fine. Now we can do a proper diagnosis of caries because we have clean surface, and now we can really see where it exists in the mouth of the patient. We move on for the last step. The last step is called the recall step. We are talking about prevention and prophylaxis, so we are talking about a continuous model care, and for this prophylaxis is not one shot only. Prevention is not one shot only. So we need to adapt the recall interval for the patient, and the patient will be back for the next appointment of GBT. With GBT we are talking about a full and comfortable and new experience of the patient. It's not only came to the practice, open the mouth and we will start working. No, we will have a talk, we will have also a partnership with the patient, and we will adapt to their needs. So we can say that this is the future, but we also can say that this is the present because we already have it. So now let's put GBT to the test and let's compare the old-fashioned methods with the guided biofilm therapy. Our R&D department puts their efforts to improve the clinician experience and the patient experience, to improve our technology and also our protocol. So let's check it out.
Spend all my money on pretty things, diamante shoes and all these diamond rings. Yes, I spend my money on these fancy cars, on a Jack in the Box and all trips to Mars. Yes, I and I, ain't got no shilling left for me. Spend all my money on expensive clothes, on a mink fur coat. Then I bought a house that goes. Yes, I
Educational is an important part of dental professional life. For that, we created the Swiss Dental Academy to share knowledge, to share information, to share experience with other clinicians. So check our Swiss Dental Academy, SDA for short, in the next video. If you want to know more about guided biofilm therapy, I invite you to follow one of our Swiss Dental Academy courses to know more about prophylaxis, about prevention, and about guided biofilm therapy. Otherwise, we have a full library of clinical evidence that backs up our technology, that backs up our protocol, that we are happy to share with you in our EMS Dental website. Thank you, enjoy IDS, and if you have any more questions, you can find us on our booth.